You should know I believe in you. Every race you run, you're my number one.
Welcome to Cat on the Couch's Beyond Chemotherapy. I am your humble host, Kat, and we are on the couch talking about cancer. Happy Friday, everyone. This week's episode, we are going to go strictly clinical. And I mentioned this in one of the previous episodes that we were going to get here. And I totally understand if you guys laugh at me trying to pronounce some of these words. And if you kind of zone out, because the clinical, I mean, it is, unless you know medical terminology, as I do not, it can be quite a handful, I guess you could say. But before we dive in, if anyone is still looking for any resources, help paying a power bill, help covering the cost of transportation, maybe the cost of a prescription, wigs, nutritional supplements, whatnot, go to episode 3. It is chock full of information pertaining to those resources. And if anyone is interested in a website that I mentioned in that episode, or really any of the episodes. Now, I can't share all of the links in the link tree. It got too full. But I do still have them. So if anyone is looking for a link from episode 3 or maybe a product or something I had talked about in one of the other episodes, send me an email. I will reply back to your email with that link. Also, if anyone is interested in sharing their cancer battle with me and allowing me to read it on one of the next episodes of the podcast, include your cancer battle story in that email or any email. And send that to me. And if there's any additional information aside from your name and email address that you don't want me to share, let me know in that email. And then also, if there's anything I can pray for you for. It doesn't take much of my time, and it doesn't cost me anything to go to God and ask Him to shine a favorable light on your situation. So please include your cancer battle stories, include anything I can pray for you about. And also, if you're interested in doing an interview, if you go back to episode 5, I interviewed Jules, and I really enjoyed that interview, and I thought it went very well. And that is definitely something I'm interested in doing again. So include that in the email. My email address is catonthecouch, couches with a K, @gmail.com. That's CATONTHEKOUCH @gmail.com. Now, before we jump in, I do want to inform our new listeners and reiterate to our recurring listeners, I am by no means a medical professional, and you're going to hear how clearly and plain as day when I pronounce some of these medicines, how true that is. But I'm not a medical professional. I'm not a doctor, oncologist, psychologist, radiologist, anesthesiologist. I'm not a nurse practitioner. I'm not even a dentist. I am just a cancer fighter sharing my story. All right, let's dive in. So we're going to begin with the dates. So August 5th, I went for my very first mammogram and ultrasound. I did find the lump in July, and I went to see my regular doctor. She, felt it and set me up with a referral to the oncology department at a cancer treatment place. She told me that it may not be nothing. It's pretty palpable, no big deal, just have it checked out just in case. So I went in pretty confident, and that confidence was misplaced, but that's okay. Maybe she just didn't want me to freak out and worry, and I'm cool with that too. But August 5th, I had my mammogram and ultrasound. It was determined that my breasts are heterogeneously dense. Which means most of my breast tissue is dense, but there are some areas that are not. And that the mass was irregular, hypoepic. No, that's not how you pronounce it either. Hypoechoic mass. Margins and posterior shadowing measured 2.4 by 1.8 by 2.0 centimeters. It was 9 centimeters from the nipple. And from my understanding, it was a total of 27 millimeter size. The the impression was highly suggestive for malignancy, which means cancer. Okay, so they weren't sure from the images, from the mammogram and the ultrasound, so they wanted to do a biopsy to test, and see if it's cancer, what type of cancer, so they can formulate a fight plan. So August 10th, I was scheduled for my biopsy, and according to the results, multiple specimens were taken and sent to pathology. The pathology report indicated malignant invasive mammary carcinoma grade 2. Recommended was surgical consultation and an MRI. And the MRI was mainly because of how dense my breast tissue is. So they had to do an MRI and then an MRI with contrast, which was very uncomfortable because, and I'm not really claustrophobic, that wasn't a big deal, but they lay you on your stomach, arms stretched in front of you, and they wheel you kind of in back. So you're not in head first for my friends out there who can be claustrophobic. So it wasn't that big a deal, but I do have carpal tunnel in both my hands. So having my hands up like that, it caused extreme tingling and numbness in my hands, which was very, very uncomfortable. Okay, so August 20th, my official diagnosis. I had my MRI done, both breasts. It was concluded grade 2 invasive carcinoma. They also noticed a 5 millimeter enhancing mass in the other breast and determined that further testing was required for that one. So, I have problems with both of my breasts are trying to kill me. August 24th, they did the biopsy of the other breast. And pathology determined that it was high-risk benign radial scarring and intraductal papillary lesion. It was also noted that I was C2, CN0, CM0, G2, ER positive, PR positive, and HER2 positive. I will get into what each of those means soon. So, moving on, August 26th, I had my overwhelming visit with the oncologist, surgeon, and radiologist. I also had my genetic test done, and there were 0 genetic markers for cancer. So it wasn't something that I inherited through my genetics from someone at some point. I mean, my mom is, she's 71. So, and she hasn't had the first cancer thing or scare. So, this is definitely, my grandmother, same thing, all my aunts. And, I have a history of cancer in my family, but it's usually lung cancer from smokers. So, or, some sort of drinking cancer, I don't know. But I didn't get this from anyone. This is just, it's not in my genetics. And if you go back to another episode, I was overanalyzing everything that I have put into my body, trying to figure out what caused it. And I'm still settled on that plastic water bottles in the dishwasher, but I digress. All right, moving on, August 30th, they sent me for a heart checkup to make, before I start my chemo, they want to see where my heart is because they have to compare it as I go through based on some of the medicines, and we'll get into those in a sec, that I'm having to take. And, the chemo injections and all that stuff. And then the very next day, I go to a different hospital. I go under anesthesia, and I get my wonderful port put in, which I was so happy to get removed. But that's a conversation for another episode. And then September 3rd, I get my first round of chemo. So the medications they prescribed to me before chemo are as follows. Dexamethasone, which is also known as Decadron. That's the one, it's a steroid. 1 day before and 2 days after chemo. If I'm not mistaken, that's supposed to ease or prevent some side effects. Levofloxacin, also known as Levaquin. That was just in case I ended up with an infection. Anything. If I had a fever over a certain number, then that would, my husband is the one that kept that just in case, because I wouldn't. There was no way I was going to be in my right mind to remember that. Lidocaine, prilocaine, also known as Imla. That was the cream for my chemo port. It was a numbing cream, so I didn't feel the needle going in. And then the last one was promethazine, also known as Phenergan for nausea. Oh, I skipped one, sorry. Ondansetron, also known as Zofran, also for nausea. I was very fortunate I did not have to take those two. I did get sick and throw up one time, but, when we get into the actual chemo drugs, the bag and the port and all that crap, I'll explain why I think I did not really need the anti-nausea pills as much. So that is the list of medication that I was prescribed. The only one I only really used two of those, and that was the dexamethasone and or whatnot, and the lidocaine. The other ones I didn't really need, thank God. But now getting into the chemo medications that I had to take. So, carboplatin, 50 milligrams, 5 milliliters, was one of the injections. It was carboplatin is actually designed to slow down the growth of the cancer cells. Another one is an injection of the steroid dexamethasone that I had to take. The one you take one day before and then you don't take it during chemo at all because they're giving it to me. So then 2 days after I take it again. They gave me 10 milligrams, and it, I mentioned this, eased the symptoms. But I did find out in my research, depending on like some chemo drugs, the dexamethasone can interfere with, certain chemo drugs. And I read that, and then I was like, well, what drugs is it? Did any of this happen with me? Because, and we'll get into why, I went into a slight panic in towards the end of the episode. But one or two of the chemo drugs that researchers have found that dexamethasone can interfere with is paclitaxel and doxorubin. I don't know what those are. I did not further research. Once I saw that those two things were not in my list, I didn't bother to continue. So, and then the next medication that I was so fortunate to have to take was docetaxel, which is also known as Taxotere. There was no dose specified in my medical charts, but that is also used to slow down the growth of cancer cells. So I was taking 2. And then another one that I had to take was fosaprepitant, also known as Amend, 150 milligrams. That too was used to ease symptoms. Oh, can't talk today. And then Palonosetron, also known as Aloxi. No dose specifications there either, used to prevent some symptoms. So, and I'm seeing a pattern here. A lot of what I was taking was to either slow down the growth of cancer cells or prevent certain symptoms. Now, this one I can see used with another one. So, okay, pertuzumab, also known as Perjeta, which is way easier to say. No dose specifications there either, but this one was designed for HER2 positive cancers. Used with Herzuma or Herceptin, which I also took. That is trastuzumab PKRB, also known as Herzuma Herceptin, 420 milligrams for HER2 positive. So the Perjeta and Herzuma together were used to kill the cancer cells. So I'm taking 1, 2 to prevent further growth, and 2 to kill the cancer cells. And I was taking 1, 2, 3 to ease or prevent certain symptoms. So that was awesome. And then, of course, the sodium chloride bolus, BOLUS, no dose specifics. That's just for hydration. So that is a list of all of the medications and injections that I have taken since September 3rd, 2021. So this month marks 2 years since I started chemotherapy. So I'm celebrating the fact that I have a good bit of my hair has grown back. Again, why? I'm so vain. Oh my goodness. Okay, back on track. So then September 4th, this was the after chemo injection, also known as a bone shot. This is the one where they stick you with this big old needle in your arm straight into your bone. At least that's my take on it. But the medicine is actually called pegfilgrastim. It is used to prevent neutropenia, which is a lack of white blood cells caused by chemo. So the chemo kills your white blood cells. This shot helps stimulate the growth of more white blood cells. And white blood cells are very important because they help you fight infections. And with all the chemo drugs that I was taking, I could have been severely, severely ill without a proper white blood cell count or growth or whatever. So I got my bone shot. After every round of chemo, I went and got that bone shot. Okay, so that pretty much wraps up. I'm not going to go any further than September. So in September, I was doing one treatment every 3 weeks. So in September, I'll have to go back and confirm, but I believe September I did do 2 rounds because of the way when I first started. And the way that the weeks fell. But again, I will just see if I can quickly confirm while I have you guys. But to go back to my diagnosis, C2, CN0, CM0, G2, ER positive, PR positive, HER2 positive. Now, I don't have a lot of detail on survival rate and remission, staying in remission rate on the triple positive, but that's what they call it. It's a triple positive. But so for those of you who are not familiar, as I was not until I decided to prep for this episode, C2 just means that the tumor is palpable and confined to one area. So I didn't metastasize. CN0 means there is no signs of cancer in the lymph nodes. Had I known this prior to my surgery, I wouldn't have had such a freak out when I woke up from surgery trying to figure out whether or not I had anything in my lymph nodes. Because they had already had significant evidence from the tumor biopsy that it did not spread to my lymph nodes. And then the CMO, or 0, it means M is for breast cancer, and the C and the 0 means there was a small number of cancer cells found in the body. Okay, and then G2 is grade 2. It's kind of like stages. I was a grade 2. Doctor actually said I was a 2B. And it's so weird because it felt so big, and I'm like, it'd been growing. My doc said it was growing for a couple of years, and I'm like, how am I just now? It's July. How am I just now realizing this? It's my body. How am I just now finding this at this size? Now, fortunately, it wasn't any bigger, but, I was just so out of touch with my body and what was going on. It's wild. And then the ER positive means that the tumors can receive signals from estrogen to grow. So estrogen is feeding my cancer. ER positive means that estrogen is feeding my cancer. PR positive means that progesterone, gesterone, hold on, progesterone, progesterone hormone. So, women have the progesterone hormone. I think I'm pronouncing that right. I did try significantly. But apparently, my cancer was ER positive and PR positive, which means it was fueled by estrogen and progesterone. So it was getting double whammy. And then the HER2 positive means I have higher than normal proteins that encourage cancer cell growth. So I was being hit from all three angles. Estrogen was feeding my cancer, progesterone hormone was feeding my cancer, and proteins. Higher than normal proteins were encouraging cancer cell growth. So I'm still in shock that I didn't find it sooner with it. My doc said it had been growing for a couple years. It doesn't make any sense that I take a shower every day. And working out, sometimes I take 2 showers. So how did I not notice that sooner? But I digress. So going back to September. So this month I had my first round of chemo September 3rd of 2021, and then my second round of chemo September 24th of 2021. If I'm not mistaken, it was the only month that I did 2 rounds, but with chemo brain and things were just, look at the timeline, how quickly things moved. I found my cancer in July. I went to the doc late July, and I had an immediate referral and appointment for a mammogram and ultrasound August 5th, and then I get my biopsy 5 days later. 10 days later, I get my MRI and my official diagnosis. Now, they told me August 10th, when it was biopsy, that it was most likely malignant cancer. And then, there would be a series of appointments, blah, blah, blah. But it wasn't official until August 20th. And then the 24th, 4 days later, I'm getting my other breast biopsied. And that is when I get the exact, term of triple positive confirmation. And then 2 days later, I am sitting with 3 doctors, one at a time, and my husband in tears over my hair and multiple other things, being overwhelmed with, the game plan, the battle plan, whatever. By August 30th, I'm getting an echo, I think it was called, on my heart, which they did regularly. They were on point with those. August 31st, I'm getting my port. And just a few days later, I'm getting my first round of chemo. This was just from finding it to getting treatment for it, it went so fast. And I'm so grateful to have my medical charts, or I would not know what worked, what my actual treatment was, because I just did everything they told me to do. They're the experts, they went to school for this. I'm paying them to save my life, and they're telling me what to do to save it, so I just did it. Of course, again, I wish I could go back and do my research firsthand, go in as a knowledgeable patient, but I guess it's better that I didn't, because then I might have had questions about different options. And then, of course, I always think I know best. Who doesn't? And I might have pushed this in a different direction and not be sitting here right now. So I guess it's good that it worked out the way it did. I'm not sure which. But one of these, told my brain to tell my ovaries to stop producing eggs or whatever, because it was, the last time I had a period was August of 2021. So the chemo, it wasn't the tamoxifen that I had to take after that I stopped taking because of all the feet pain that sent me into menopause, and tamoxifen can do it. But I don't know which one. I need to do some more research. But one of the chemo drugs, at least one, is a hormone blocker, and has sent me into full blown menopause. But I will do more research on that. And if any of you out there listening who know which one, or if it's all of them, send that in an email. Let me know in the email, because this kind of stuff, it's like a whole nother language to me. Like it's like car talk, or medical talk, car talk, things like that. It's just my brain does not want to compute. So going through this and trying to find which medicine was, or if all of them or whatever were hormone blockers. It makes sense that they would give me hormone blockers, though, because of all the estrogen, the hormones and everything was fueling my cancer, and the proteins or whatever. So it makes perfect sense that they would give me that. But I'd like to know which one, if not all of them, was the one that sent me into menopause. All right. Well, that wraps up this episode of The Clinical. Thank you guys so much. If you're still listening, you are a trooper for sticking it out. If you are interested in sharing your little, medical history of, the chemo and the chemo medications and drugs and everything that you had to take, send that to me in an email, catonthecouch@gmail.com, catonthekouch@gmail.com. Let me know in that email. Let me know if I can read it in one of the episodes. I'd like to know what my listeners have had to take, or if you are a caregiver, what the person you're caring for, or people you're caring for, what they have to take or had to take or whatnot. So yes, please send that to me in an email. But before we wrap up, I do want to go to the giving portion of this podcast. This is for Brad Taylor Memorial Fund. Because we are at the end of September, this is the last week I'm going to highlight Brad Taylor Memorial Fund. But Brad has passed away from lung cancer that had spread into his bones. He had pneumonia, went to the doctor, and this does sound very familiar with my mother-in-law. If you listen to any of the earlier episodes, she had lung cancer, but they didn't find it until she had pneumonia. So they didn't find his until he had pneumonia, and by then it had already spread to his bones. And he has passed away. He has survived by his wife and two children, two daughters. One's 2 months old, the other's 3 years old. So I don't know what the financial situation is, but if the wife was not working now, she does have to, or she may have to. And the children are going to grow up without their dad. So obviously we're not asking anyone to go broke, but if you can afford to give, please click on the link in the link tree. It's in the description. And donate. If you can't afford to donate, that's perfectly okay. If you know someone with cancer or a caregiver, reach out to them, offer to your time, like cook them a meal, or maybe pick up a prescription, or, offer to pray with them. Obviously, I definitely ask that you pray for Brad's wife and his daughters and the family. But, anybody out there that you know personally with cancer or a caregiver, offer to pray with them. Prayer goes a long way. It absolutely does. All right, and then lastly, I want to read Proverbs 3:5-6. So I picked this one today because of my complete blind trust in the medical people, oncologists, nurses, all that stuff. My complete blind trust in doing what they are recommending that I do to save my life. And I have that same blind trust in God. Trust in the Lord with all your heart and lean not on your own understanding. In all your ways submit to him. He will make your path straight. Proverbs 3:5-6. Had I not just put my trust in the path God set in front of me, I may not be here with you guys today. So I'm giving him all of the credit. He was with me every step of the way. And he gave my doctors and nurses and everybody wisdom and guidance. And they gave it to, they told me what I needed to do. They gave me the medicines I needed to do, and it saved my life. Trust in the Lord with all your heart and lean not on your own understanding. In all your ways submit to him, and he will make your paths right or straight. And I said this earlier, had I done any type of a research, I could have walked in there thinking I knew everything. No medical degree, just read some stuff online, and completely ruined this. Ruined my cancer battle. So I'm very glad that I was ignorant. That may not be the case for everybody. I'm not saying that you should just go in blind and just, trust, ask questions, always ask questions. Whether it's your doctor or some authority or whatever, always question. But the route I took, it worked for me. I gave it to God, and God took care of me. All right, guys. Well, that is it for another episode of Beyond Chemotherapy podcast. Don't forget to send me your emails. Also, not crazy about social media, but I am on Facebook, Instagram, X, formerly Twitter, TikTok, and there's another one, Snapchat. I think I'm on all of them. But look up Cat on the Couch, or just Cat Couch, and Couch is always with a K. And follow me, like, subscribe, rate, whatever, share. Love you guys. Thank you so much for listening. And in Jesus' name, have the best week. The Beyond Chemotherapy podcast is a platform only for anyone interested in having a conversation about their cancer fight. The Beyond Chemotherapy podcast does not represent any healthcare service. The Beyond Chemotherapy podcast host and guests are not medical professionals and are not giving any medical advice. The Beyond Chemotherapy podcast host and guests are not suggesting ignoring actual medical or healthcare advice. The Beyond Chemotherapy podcast host and guests do always recommend consulting with your doctor or other healthcare professional. Views and opinions expressed on the Beyond Chemotherapy podcast do not necessarily represent the views and opinions of the podcast screening platform. Listeners to the Beyond Chemotherapy podcast use information from this podcast at their own risk.